All right, guys, it's Dr. Emer in West Hollywood, and now we're doing subcision with a cannula for acne scars. This is probably the last treatment because as we're moving through, I feel the Bellafill on top, but I'm underneath and kind of going through and subcising, and actually it's moving pretty good. There's only a few places where I actually feel some resistance, like right there, where that will get broken apart, which means the majority of the scarring my patient has is textural, meaning we need to do lasers long-term and peels and continue to do fillers if needed, and do skin tightening. So right now we're going there, we're going deeper than where I did the Bellafill to try and get improvement without moving the Bellafill. But on his case, even if you move Bellafill around a little bit, it's collagen production that's going to go in a large area and it would be okay. So you can see, very free moving, see? That's great. Even when I pinch the skin and try and grab the scars, it's pretty free moving. So that's really, really good. That means that the subcision has been working and that we're getting a lot of the superficial textural issue. How's the pain?
No pain.
Great. So minimal pain, and we're moving through. You can hear it if you listen really close. You hear that? You guys heard it, didn't you? Because we grabbed that piece, that one piece, it's like little cellulite in the skin of the face, and we just break it. Here? Listen. It's like a scrub that's gone. Damn, you got it. It's a good thing though. So now we're gonna move up into the temple area, which again is notorious for issues because of blood vessels. So cannula here is really good. In the old days, we used to use a no-core needle, which is a special type of like basically a razor blade under the skin, and it can be good for certain people. But in this case, let me grab the needle really quick. In this case for him, the risk is higher. Go ahead and grab that. And so I don't want to do that, so we're gonna just do cannula. There's some veins over here, so it's not surprising if someone bleeds a little. There we go. Give it a little numbing. You hear that? Actually, the majority of these are improved. There we go. Okay. So now I'm going to have you hold right here. Firm pressure, like that. Okay, now let go. Turn to the right. Great. So now we're going to replace the cannula. We're going to go to the opposite side. And we're going to do a similar thing. You see I've pre-marked the spots here and here in the temple. The rest of this is just irregular texture. You can see there's really no soft tissue bands. Even if I pull all the skin back, look at how soft his skin is. It's actually very good.
Can
We're gonna go ahead.
can you see improvement right after subcision is
Not
over?
usually. It takes about 6 weeks or so, 4 to 6 weeks. Some people will see it even sooner than that, depending on if they're a good candidate or not. I find a lot of people are not good candidates, but yet they still get the treatment requested to be done. So
I saw improvement within 2 weeks.
yeah, within 2 weeks he saw it. And I think honestly we've pretty much gotten almost all of the areas that we want to get. There we go. We're literally going right under there and breaking apart that tissue.
This is kind of like Sulfina, but for acne
So, yeah,
scars.
for face.
For face.
Very much. So that's all released. Okay. So we hold a little pressure there. Now we're going to finish with the cheek and temple. That's subcision combined with filler. He's going to do a peel in a second, which I'll show you in a minute.